Hi there. Welcome to Real Talk, a space where psychology meets culture, community, and unapologetic truth. We are Dr. Denise Watkins and Dr. Erica Dawkins, two Black psych types at different stages of our careers. We are here to unpack the real life issues that impact our mental health, relationships, and resilience in a revolutionary way. From trauma to triumph, therapy to theology, we hold space for healing, growth, and the conversations we feel our communities deserve. This is Real Talk, raw, relevant, revolutionary, and rooted in love.
Yes. So to begin, we would like to do an acknowledgement of historical presence. We begin this episode of the Real Talk podcast by honoring the original stewards of the land on which we gather. We acknowledge that the Delaware Valley and much of Pennsylvania are the ancestral homelands of the Lenape and Susquehannock peoples. These indigenous nations lived, loved, and led on this land long before colonization, cultivating rich culture, languages, and traditions that shaped the region. We recognize the enduring impact of their displacement and honor their legacy with gratitude and respect.
Absolutely. So, welcome back to our second episode in the month of October. And we are titling this episode, The Spirit Remains. So, we're talking about creating a safe space and looking at providing care to Indigenous peoples. So, we think about the transition and change in terms of language from Native Americans to Indigenous people, and even a language that's been adopted by the American Psychological Association in terms of First Peoples of the United States, recognizing the Indigenous roots that have shaped culture brought more broadly in the world, but specifically here in the United States. And we are rooted in Pennsylvania, and so we'll be focusing on Pennsylvania for sure.
Absolutely. Yes, it's just important for us to acknowledge the shifts and changes, but also just understanding how the culture of Indigenous peoples is linked and related to their mental health and other events that are occurring within their group. So
Yeah, I think one of the first things we definitely want to acknowledge is, I'll speak for myself. I know that Indigenous heritage in my own family goes back very far, and so don't feel connected and recognize that ideally it is important for individuals that hold membership in certain groups to speak about those groups, and it's something that I think we would love to be able to access in the future, and felt that it was still really important for us to talk about the mental health aspects, especially here in Indigenous Peoples Month.
yes, absolutely. So to start, suicide is the second leading cause of death for Native youth, ages 10 to 24, and the suicide rate is 2.5 to 3 times higher than the overall U.S. average. In 2019, the rate among among Indigenous populations was 22.2 per 100,000, compared to 13.2 per 100,000 for the general population. So just to kind of make sense of some of these statistical facts that we're discussing, this means that Indigenous people are experiencing a disproportionate rate of suicide risk and death by suicide. And in the United States, Native or Indigenous populations report higher rates of binge drinking and alcohol use disorders compared to the general population. In 2020, about 12.8 of Indigenous adults reported an alcohol use disorder compared to 5.4 of the general population. Deaths from alcohol-related causes among Indigenous individuals are over 5 times the national average. So when we're also factoring that in, that just also gives you an understanding that there is a risk of substance use or substance use disorders that could also be in turn impacting the community and possibly also leading to death by suicide or death accidentally.
We also know, and we've talked about this in a lot of clinical settings, that we oftentimes will have co-occurrence when there's substance use. So other mental health diagnoses can be impacted by the presence and use of substance, like depression, like anxiety, can be exacerbated, as well as the fact that some substance use can be catalysts for other disorders that previously may have been dormant or need or are oftentimes sparked by a stressful or stress-related event. And we also can see things like substance use following something like a post-traumatic stressful event, and really make what we would consider to be navigating those diagnoses more challenging.
Absolutely. To continue with some other statistics, The Missing and Murdered Indigenous Women's Organization, they highlight that there is a crisis occurring among Indigenous women, where Indigenous women are murdered at rates 10 times higher than the national average in some regions. In 2020, the National Crime Information Center reported 5,295 missing Indigenous women and girls. When we think about this, this means that women from this culture are predisposed to maybe violence and other harmful experiences. And so it's very important, to remain aware of that disproportionate likelihood for violence against women who are Indigenous.
Yeah, it makes me think a little bit about some of the conversations that we have, even in the Black community, about when women and girls go missing, that there doesn't seem to be as much uproar or outcry or even awareness. And so, like, you sharing the rates of Indigenous women and girls that have gone missing, my question is always, why haven't we heard more? Why aren't we hearing more? Why aren't we talking more? It makes me think about how even just recently there's been a particular code that some states have adopted in terms of, like, I want to say it's something like the Black, like, or brown hotline, or something like a brown tip, so that when a person or woman, a person of color goes missing or is abducted, that's the level of amber alert that goes out as opposed to like a child.
Yes, yeah, I've heard of that as well. It's similar to the Amber Alert system, but it is specifically, I guess, highlighting that this is a Black or brown person who is missing, to kind of, like, I guess, galvanize the community in wanting to kind of assist in finding them, because the likelihood is that they may not get the same level of attention that someone who is white or white presenting would get.
Which is unfortunate. And I think something, at least when I think about talking with students and even former students, right? When we think about developing a posture that is supporting different presentations, I think it's something that people automatically don't think about. They assume that as a member of humanity, that there is an interest in supporting and a, kind of equitable desire to support, but that's not true. And it makes me think a little bit about what is important in terms of our role as clinicians to cultivate when it comes to understanding of difference. And, we in the field talk about it as being culturally competent, or more so being kind of developing a level of cultural humility. But wondering, like, what is important about developing and working that muscle of cultural humility, especially when it comes to Indigenous populations, from your point of view?
From my point of view, I think about individuals who identify as Indigenous and what is important to them, what kinds of values that they may have that differ even from myself, being an African American woman, but also from the larger global experience, or the U.S. experience, right? And I think about the connection between mind, body, and spirit, and their reverence for nature and for animals, but also their reverence for turning inward and kind of doing deep soul searching, or even using herbs or different types of plants or methods to kind of tap into what's going on in here, and then what's going on around you, and connecting that. So I think it's important from my point of view, if as a clinician you're wanting to work with these communities, that you do inner work, right? And focus on what's going on within you that may come up and maybe be a barrier in the therapy room, but also understanding, when you're working with an individual from a specific tribe, actually what are the values of their tribe? What measures or methods do they kind of use that align with their life? And when you're working with them, asking them that with some direct experience, right? Instead of kind of maybe using the traditional way of like, oh, let me assess you, right? You can also kind of have open discussion with them about what it is they want, what aligns with their own identity.
Absolutely. I think this is such a timely opportunity for us to have this discussion. I teach diversity in this particular program, and we actually are on the week related to Indigenous people. And part of the conversation that we had been having is around, like, when we get education and knowledge about the history of colonization, the impact of colonization, how in some settings it has previously been that the colonizers are seen as, saviors, the focus is there, the day is dedicated to them, rather than on the impact of colonization on Indigenous peoples and First People communities, and what is still like a lingering effect.
Yes.
And so one of the things that I think about too is like being able to hold space to bear witness for the long lasting, systemic impact that colonization has had on First Peoples. Some people, I remember in the class kind of remarked about the fact that their first introduction to Indigenous peoples or learning about the impact of colonization was in college, and that there had not been previous focus. And then some folks that maybe live in areas where an Indigenous presence was more notable has some from day one, had a level of respect and reference for the community. But I think that there's so much variation that it's important when we are in clinical spaces that Indigenous people are seeking out, that there's an opportunity to be able to kind of acknowledge essentially and allow there to be a telling of one's own narrative and story as it relates to the experience and impact of colonization on people.
Absolutely. Yeah, I mean, I think that's a beautiful way of the way you put it, and also acknowledging that like there is maybe unfortunately a lack of understanding or knowledge due to where you may be living or what level of education you've had, and also recognizing that to some degree you have to remain respectful too. You can't like insert yourself in spaces without permission and things of that sort. So trying to make sure that when you're seeking to learn, you're also doing it with a level of respect and not, pushing your way into places you may not belong.
Absolutely. Yeah, especially thinking about kind of the community and relational nature. You reference kind of this mind, body, spirit, nature connection that has, I think, been both appreciated and seen in a very reverent nature for Indigenous peoples, but also has been capitalized on in a number of ways. And so when you think about when you're talking about being mindful and respectful of being able to see what's happening in a community without inserting oneself, I think that also applies to in the therapeutic space. What does it look like to ask clients about how important the community is to them, and what are the relationships that, while they may be impacting them negatively and maybe contributing to part of why they may be seeking therapy with us, what does it also look like to be able to kind of navigate them so that they remain, if that's part of the client's goal?
Yes, yeah.
So it is probably really helpful if we just think about systemic approaches, and because our Western philosophy and kind of psychological approaches oftentimes are more individualistic, are more white-centered, and oftentimes a number of racial, ethnic, and Indigenous demographics lean more towards community and relational. And so it's important for us to keep that in mind when we're supporting solutioning and kind of navigation of mental health with folks that are seeking support from us.
Yes, absolutely. Yeah, one of the things that's coming to mind when you say that, I'm thinking of a form of therapy I recently read about, which is called network therapy, and it's touted as something that works very well when you're working with Indigenous communities, because there is a sense of community that is one of the values that are apparent among their identities. And when you're doing this approach, what is helpful is to incorporate not only what this individual is saying they need for self, but also thinking about how they may speak about their family and like how the family could possibly be incorporated, or how they may speak about the community at large, and then how you incorporate that element. Even something like their job or what they may do for a living and for their employment, that can also be incorporated. But the main feature is trying to put all of these pieces of their network together that make the larger piece of themselves, and what's important to them, and then kind of trying to piece these parts in so that they're addressed, but they're addressed in a way that it almost seems like you're doing parts and then the whole all together. And so that's just one kind of approach. There are many others, but that's one that's actually well empirically supported.
Awesome. Thank you. I've never heard of network therapy, so thank you for educating me and even introducing.
Okay. Thank you for allowing me to. So then also, bringing in indigenous healing practices, such as the sweat lodge, where people will sit in a room. It's almost kind of like a sauna. They're doing some kind of deep reflection within. It helps you kind of to really sit with, you know, uncomfortable external feelings, but uncomfortable internal feelings. And the hope is when the person comes out of the sweat lodge that they have some kind of resolve around what the issue is, or the focus of what they were just trying to explore in the sweat lodge. And then also using certain substances to then kind of do self-reflection through, I guess we would call it like a trip. But that is something that's different and would require a specialist, someone who is, you know, very well versed in that, and would be overseeing the trip in order to ensure the safety of the client.
Yeah. Yeah, I think you highlight a great point around kind of the connection and the interdisciplinary nature that our work can shape. It doesn't just have to be all talk therapy and kind of fumbling through where there's a lot of learning that would be required, I'll say for myself, you know, and someone like my part, to be able to understand and integrate things that are related to an Indigenous or First Peoples culture. If we call in folks that are experts in their own maybe healing practices and infuse that into the treatment, it really makes for a nice collaborative opportunity, and really allows for clients to shape and support in the co-creation of their own healing. I think all too often clinicians feel that they're the end all be all and they know the best evidence-based treatment to be able to support folks. But the reality is, like you mentioned, it's not uncommon for Native groups to turn inward or to turn to the community. And I think sometimes what we are ignoring is the impact that trauma has had, that has made traditional practices exponentially harder for folks. And so our role is to come and aid with the, you know, things that maybe groups have not been able to control for or correct for yet, and to add that to traditional practices as opposed to try to avoid and take away.
Absolutely, yeah. I mean, you know, if you're, especially if you're person-centered, you know, why not collaborate? Why not, you know, make connections with people who may have the knowledge that could further the work that you're doing.
Right. Yeah. I'm wondering, what are some things I think about for myself, for maybe other groups that I might support, but what are some things that clinicians could and should do to be able to make sure that they are growing and working that muscle around a level of cultural humility?
Yeah, well, I mean, you know, first and foremost, and if you're a reader, if you're a bookworm like me, you can read books. You know, there are a ton of books out there that would really feed the understanding of working with Indigenous groups, and also just your understanding of Indigenous culture as well. You know, there's one specific book called The Sacred Hook, by Paula Gunn Allen. And this book focuses on Indigenous women and spirituality. There's also another book called Decolonizing Trauma Work by Renee Linklater. The focus of this book is the healing practices that are rooted in Indigenous worldviews. And then another book called Braiding Sweetgrass by Robin Wall Kimmerer, which is just another a resource that talks about Indigenous understandings and values, their ecology and approaches to healing. In addition, there's also some academic journals that might also interest you, and that would be the International Journal of Indigenous Health or the American Indian and Alaska Native Mental Health Research academic journal. And then, you know, if you're interested in looking over at websites, there's the National Native American Boarding School Healing Coalition, also the First Nations Health Authority, which is based out of Canada, but also has information about tribes and territories here in the U.S. So that's a start if you're a reader, but you can also reach out to the community, right? When I was preparing for this podcast, I Googled and found a resource that was able to be used to identify what tribes were present here in the Delaware Valley. And the name of that resource is the Native Land Digital. It's at native-land.ca, where you can actually Google wherever you are, whether you're in Canada or other parts of the U.S., you can Google and see what is the tribe that or territory that would be most frequent in your area. Or if you're trying to understand information about a specific individual, you can look at the information of the tribe there as well. You can also just look for community events, and be mindful too that you can't just show up. You have to see if it's open to the public. If it's open to the public, then absolutely attend. But if it's not something that's open to the public, it might not be, of your best interest to just show up. If you require an invitation, seek an invitation if you can. Listening to the elders and the people who are most knowledgeable in the group. If you're able to seek out individuals who are what you would consider the older individuals of the tribe, or even maybe the medicine men or women or person, you want to seek that person out and try to see if you can communicate with them, if they're open to discussing with you some of the things that might be helpful. And then also you can use social media. We are all on our phones at some point throughout the day, and so you can use Instagram or TikTok or Facebook to look up leaders and maybe individuals, public figures in these tribes or groups that you can get some understanding from or look to for more information. I think that's enough.
A good place to start, right?
Yes.
Yeah, and I think one of the things that we in our kind of training and education as clinicians talk a lot about is like the onus and responsibility is on us to start the exploration. We should not overburden a client with coming in and talking about their own stuff, but also adding a responsibility to teach us on top of that, to be able to be the one responsible for talking about their problem and providing information about their lived experience, that we have some responsibility to do our own due diligence. And so what you shared in terms of resources is a great place for us to start, and is going to be different and vary kind of based on where we're present. So being able to make those access to resources relevant to where we are is a great first step.
Absolutely. I agree. Then, also, again, like I said in the beginning, being open to asking the client themselves, what is it, are there any cultural or spiritual practices that are important to your healing that you'd like me to know about or incorporate into our work? How would it feel to bring those into the space? Are there parts that are appropriate for us to invite? Those that you need to do on your own, things that are private or with, whoever the important person in the group or the tribe or the person who handles those types of needs. Would it be important for that person to be notified? It's kind of like what the network therapy says too, which is getting to understand who is in their group, in their community that they would want to incorporate into their work. And then, be willing to reflect with yourself. I think that's also heavily important. We all have our biases. None of us are,
It's free.
Yeah. Like none of us are left untouched by that
Absolutely.
bias or prejudice. And
Absolutely.
so, it's really important for us to reflect about what biases may come up for us. Where are they coming from? What are they related to? How do we want to address them to be able to connect and relate to the client? It wouldn't be fair for us to place on the client that responsibility to come through that. That's something that's our job, and so, really get in touch with your understanding of why you may not have a desire, to know or understand these things, and then try to come past that, because, if you want to give a good standard of care, if you want to work with these folks, you want to be able to acknowledge that there may be some parts of you that think or know something, based on a stereotype instead of like the truth. Yeah. So
that's a really good point. I mean, and I think about what maybe comes up even as clients are trying to educate us about what is important in their experience or important in their culture, that there may be a level of like shame or even guilt that comes up. One, for the client in terms of their lived experience, right? That needs to be navigated, but also for us as the clinician about being ignorant or, having this be the first exposure or, as you mentioned, kind of those things that pop up for us that our first thoughts, our prejudice, the things that we assume about the people that we're working with, we might have a lot of shame or embarrassment around having those thoughts. And I think that's where a good supervisory relationship is important, to be able to bring those things, so that it doesn't like bleed all over the client, but slowing down and us really being able to be aware of those on our own is so important. A lot of cultural work in terms of strengthening that level of humility is being aware and remaining curious, not only for our clients, but for ourselves about things that come up when we're doing this work, things that get turned and those buttons that get pushed.
Yes, yeah. And I think someone would really appreciate that too. You know, that level of authenticity and realness is, you know, saying, I'm not sure, you know, or I don't know, or I apologize, right? When I have maybe said or done something that could be viewed as like a rupture or a microaggression. Being able to own that and then work on it is probably going to really help your relationship.
Absolutely. And then recognizing those limits. You know, if the person's work is really rooted in Indigenous practice and need and maybe experience, and there is a barrier, sometimes you know, kind of mention that there are things that are sacred, things that are navigated that are not for the out group.
Yes.
And so what does it look like to navigate understanding of that with a client, and then making appropriate referrals if there is an in-group need to address it. Just recognizing limits to competence and capability to really be able to support a client in that way. Yeah.
Absolutely.
I mean, I know one of the things that we did prepare, similar to what we have shared with folks last time, were just some resources, especially given some of the statistics that you shared at the very beginning about suicide, you know, kind of proneness, given the pushing to the outskirts, some of the kind of substance use. And so maybe as we get ready to wrap, we can talk a little bit about some supports that might be available to Indigenous folks specifically.
Yeah. So to start, you know, as we mentioned in our previous video, which was about suicide prevention among BIPOC individuals, we are going to bring it up here again because this resource is lovely in that it's really there for so many people with so many different identities. 988, the Suicide and Crisis Lifeline, you can call or text. And when you do call or text, you do have the opportunity to identify yourself. So if you do identify as Indigenous and you want to have someone talking to you that understands that you're from that identity background, you mentioned that in the call or the text. I believe when you call, there's choices, and then you're able to let them know that you're looking for someone who knows how to kind of approach it from that standpoint. There's also the Strong Hearts Native Helpline, 1-844-7-NATIVE or 1-844-762-8483. This is a culturally appropriate, confidential support for Indigenous individuals who have experienced domestic or sexual violence. As we've previously stated, there is a higher risk of violence against women among Indigenous individuals, so we want to make sure that you have a resource for that as well if that's something that you need. Then there's the Native Youth Crisis Hotline, 1-877-209-1266, and this is specifically for Indigenous youth who are in crisis. So if you are a teen, an adolescent, and you have access to a phone, that is a resource that you can use when you need it. And then there's the substance use support. So there's the SAMHSA, Tribal Affairs, and that's SAMHSA.gov, and they're programs that are tailored to Indigenous communities for substance use and mental health. And because of the fact that there's a higher risk of substance use among Indigenous individuals, this is a resource that can be utilized if necessary. And then the White Bison Wellbriety Movement, which is another organization. They do culturally grounded recovery support for individuals who experience alcohol use and other substance use issues. And then finally, there's a general Indigenous mental health program called One Sky Center. And this is just a national resource in the U.S. For Indigenous mental health and substance use treatment. They can help you kind of connect with people in your area when you might be looking for someone to work with. And then some online community-based supports like the Therapy Den, also known as Inclusive Therapists. They have a directory where you can actually search and filter for people who are specialized in working with Indigenous individuals. And then the Indigenous Crisis text line, where you're able to text Native, NATIVE, to 741-741 and connect with a trained crisis counselor. And then finally, the local tribal health centers. If you are living in an Indigenous community, there are some local tribal health centers that are designated, and you can just show up there, ask for assistance. They will provide you assistance, especially when it comes to like the wellness programs or community-based crisis needs. So you're able to also check on like offerings of events and learn about what other tribes are local to the tribes at these kinds of centers.
Dr. Watkins, I just have to kind of reiterate again, I appreciate like your level of sensitivity and understanding about even starting this space with these really important conversations. I think the only space, at least even in my training, that we talked about working with First Peoples or individuals that have Indigenous heritage was kind of diversity, and to see representation being more woven throughout, thinking about APA's recent recognition of harm that was caused to Indigenous people, thinking about the push and the responsibility, as well as the commitment to increasing things like research and treatment modalities that were maybe previously westernized that now need to be modified to be appropriate for addressing the needs of Indigenous people. I just think it is, again, a timely part of conversations that we all need to be having about how we can do that, especially as mental health practitioners. And so I want to thank you again for suggesting this as our second episode in terms of how we have these conversations just across the kind of psych career trajectory, and thinking about clinically. And I'm thinking as we continue with these kind of conversations, we start to also include things like advocacy, which oftentimes we find ourselves getting in as psychologists when it impacts us. But what does it look for us to advocate for our clients, and their needs outside of the therapeutic space and outside of the way that therapy is impacted. So I'm really, again, appreciative of your sensitivity and framing, and I look forward to thinking about other ways that we could expound upon that.
I agree. Advocating can be done in so many ways, and I think it's important that we think about, like you said, outside of the therapy space and just using our voices. It doesn't have to be big, bold statements. It can be what you post on your social media. It can also just be you showing up at a protest, or even something as simple as, acknowledging the land on which you are living, and know that the land acknowledgement is not a used to be, it's still current, and that those people exist and will continue to exist. So, just to kind of wrap it up, we're going to be acknowledging the continuing legacy and presence of the Lenape and the Susquehannock people. As we speak and share on the Real Talk podcast, we recognize that the Lenape and Susquehannock people are not just part of the history. They are present, resilient, and thriving. We honor that continued contributions to culture, community, and justice, and we affirm that indigenous sovereignty and identity persist. This land remains sacred, and we commit to amplifying Indigenous voices and supporting efforts toward healing, equity, and restoration.
Absolutely beautiful, and we will continue to make that commitment. Thank you so much. And thank you all for tuning in to our second episode of Real Talk with Dr. Watkins and Dawkins. We are here to try our best to keep our conversations honest, healing, and rooted in the realities of the communities in which we serve. If you found today's episode meaningful or helpful, please share it with someone that you love. And don't forget to subscribe, rate us, leave a review, a comment. You can follow us on social media for any updates, resources, and behind-the-scenes moments. Until next time, we encourage you to keep showing up, keep speaking truth, and keep doing the work. And this is Real Talk. We'll see you next time. Bye.